I'm sure some of you know this phrase, but it takes a village. It certainly takes a village to take care of patients. And so I've invited Dr. Chris Andry to come and talk with us about really the mechanics of how we take care of patients, especially at a place like this institution. And again, I encourage you to take what you're hearing today, go back to your home institution and think about how it compares and contrasts the resources, how patients get in the door, how we care for them, what our unique challenges are, and what the opportunities for you are as a biomedical engineer doing all kinds of work, the interesting features of your patients and your institution. So with that, I'm going to invite Dr. Andry.
Okay. Thank you very much, Jen. Thank you very much, Dr. Rosen, for organizing this event and for inviting me to represent the Boston Medical Center BU Cancer Care Center. So my name is Chris Andry. I'm the Executive Director for Cancer Care Services at Boston Medical Center. I'm also the Vice Chair for Pathology here at BU. And I'm just going to take 15 minutes to give you a little overview of our cancer center here at BMC, talk about really the rich and deep services that we provide here at our safety net hospital, and just give you an overview of those services, speak to how we take care of our patients, many of whom come from very diverse backgrounds, diverse countries, and how special attention needs to be paid to those patients. And then I have a few slides at the end to talk about our biospecimen archive here at Boston University, where we collect samples from consented patients and make them available to the research community. So here's a nice photograph of BMC. And so just to give you a little summary, we're the largest safety net hospital here in New England, 508 licensed beds, over 6,000 employees, 55% of those who are from self-declared and self-described ethnic minorities. And we draw a lot of our employees from the community around Boston Medical Center, over 12,000 physicians, 1,200 physicians and 1,500 nurses. And we're a primary teaching affiliate of Boston University School of Medicine. And I might add, we work very closely with the School of Dental Medicine as well. And we have 79 residency training programs and a comprehensive range of inpatient clinical and diagnostic services with all the medical subspecialties that you'd expect of a large academic medical center. This is an important slide. It shows the 15 affiliated health centers around Boston, where about 30 to 35% of our patients draw into our medical center. As those of you who know Boston, many of these areas are areas that are defined as underserved and as far-reaching into Mattapan Community Health Center and Manat there on the coast, and then working the way in towards Boston, these other health centers. Now, about 15 years ago, this network was formed and termed the Boston Health Net. And this is a very important connection for Boston Medical Center and for our patients who are cared for in the community at these health centers, and then who come into BMC for their tertiary care and then return to their health centers and develop a relationship with the hospital. And this is an integrated healthcare delivery system that we hope is going to prove to be a model for future accountable care organizations. So this is our recently branded Cancer Care Center at Boston Medical Center. It's the beautiful Moakley building here. BMC has always provided cancer care services to the Boston community and beyond, predominantly in the 128 Beltway, but mostly about 50% of our patients come from Suffolk County. But we've never actually sort of brought together under an official banner our cancer center at the hospital. As you know, we have lots of colleagues and partners over at Longwood Ave and large, well-known cancer centers. But here's a large, well-defined cancer center in the heart of Boston, caring for a large population that is self-declared as minority or underrepresented. We have multidisciplinary care here in HEMONC and RADONC, a well-known breast imaging and breast health center, and then ambulatory laryngology, head and neck, and other surgical oncology services that are broad-ranged and extensive. We were recently awarded an award with distinction from the Commission on Cancer for the quality of services that provided by the Cancer Center, which was a validation of the hard work that our employees of both faculty and support staff perform. So here's just give you a few examples of the detailed services that the hospital provides before I talk about the additional network services that are so key for our cancer center. So we do provide autologous stem cell transplant program with outpatient peripheral blood stem cell transplants, treatments for myeloma and lymphoma and leukemia. We're a leading referral center in the US for rare blood disorders, particularly amyloidosis. We have a national, if not international, patient base there of patients who come in for their amyloid workup and amyloid treatment. And then we have various accreditations from different organizations. We're a regional tertiary referral center for head and neck cancer with the first transoral da Vinci robotic head and neck surgery program. We have some leading head and neck cancer surgeons, Dr. Sharuk Jalisi and many others, providing sophisticated surgery here at BUMC. Many of these major surgeries are also performed in collaboration with our colleagues in oral maxillofacial surgery, where we're able to do free flaps and help patients recover faster. You just heard from Dr. Fernando, who works in the Center for Thoracic Oncology, who's also very interested in robotic and minimally invasive surgeries. And surgeons experienced in GYN-onc, and we also have a CyberKnife here, which really provides, state-of-the-art equipment and facilities to our patients in the inner city, which is wonderful to make those services available to everyone and provide a standard of cancer care that's second to none. And we were the second hospital in New England to offer this treatment. And this amazing robotic therapy allows pinpoint treatment, radiation treatment, and we've served over 250 patients to date. And you can use it to treat benign and malignant brain tumors, lung cancer and liver cancers, and so on. So really a very important facility based in the heart of Boston and available to a wide and varied patient population. So I really want to touch on Cancer Patient Navigator program. This is a wonderful program that's run at the hospital for the last 10 years. It was founded by a woman called Kathy Finn, is now headed up by a woman called Katie Finn and her staff. And this is really a very, very important service that we offer to our patients. Many of our patients have, additional challenges just getting to the hospital. We were just at a quality meeting today and saw some remarkable statistics on patients who are missing their appointments. These are patients who have a breast cancer diagnosis, for example, and are unable to make their appointment for a variety of reasons. Maybe they're paid by the day or the hour. Maybe they have trouble getting care for their children at home. Maybe they have transportation issues. Maybe they have other life issues that they feel are more important than their cancer treatment. And so our Cancer Patient Navigators play a critical role in helping our patients come into the hospital, get their treatment, make sure they don't miss appointments. We did a little study last summer which demonstrated that if a patient at BMC is touched by a Cancer Patient Navigator, there's a reduction by 50% in the no-show rate. And you might think how remarkable that is, that a patient with a cancer diagnosis would no-show to their appointment, but sadly it's true, and these patients are overcoming many, many barriers to get into the hospital, and it's so important for us to have this program. So I've touched on a number of these items, and what's also very important is our navigators lead our patients both in the community and provide services through health fairs, and reach out into the community and maintain a special relationship with patients. And we hold celebratory events at the hospital, which are really a way of connecting with our patients. They come in and really it feels like family for them. BUMC, just to point out that the additional sort of non-medical services that we have to provide to help our patients, we have a food pantry and a demonstration kitchen, have a very large and well-known interpreter services program. What's very exciting now is we're able to provide video interpreter services for our patients. We trialed these little video units up on the HEMONC floor. They've been very helpful. We're able to reduce the amount of time that we have to wait for an interpreter to come, and the patients like it, and they're able to communicate with their physician or healthcare provider via these video interpreters. And then we have the BMC Grow Clinic, which is a national model for treating children run out of the Department of Pediatrics. And just some other things, and these are really things that, you know, when we go to meetings and talk about the work at BMC, and things that possibly cancer centers in the suburbs don't think about. So for instance, running a program for child witness to violence, you know, to think that a family has to help a child and possibly a parent who's also had a cancer diagnosis and needs extra support. We have the Medical Legal Partnership. And then we run a wide-reaching shuttle bus service to help our patients get into the hospital. And we moved close to 200,000 patients last year. Dr. Fernando was talking about clinical trials, and so we were recently awarded a minority-based community clinical oncology program grant through the NCI, and this is specifically designed to enhance the enrollment of self-described minority population and make cancer prevention, treatment, and symptom management available to those patients. There is an incredibly low national enrollment rate. I believe it's around 2% for people who self-declare as minorities. At BMC, the enrollment rate is 38%. We have trials available, over 100 trials available to our patients, and this is a very important opportunity to reduce disparities for access. Now, clinical trials in the minority population have been viewed at times with suspicion, and it's very important for us to help patients make informed decisions, make sure that they understand the opportunities that these clinical trials offer them, and that they get a chance to enroll if they so choose. And it's really the other connection with the MB-CCOP is that our navigators have reached out into the community and have been offering a lot of training in the last 2 years to navigators placed at 5 participating health centers, so that we can help navigate a patient from the community health center into BMC for their care and then back out into the community safely and make sure that they're following up. And then our commitment to research doesn't end there. We offer a lot of other cancer support services, and here a lot of survivorship activities. Again, our diverse patient population is able to come into BMC. They're living locally. They can come in, take advantage of integrative medicine that's now available, acupuncture and massage. And then we have a lot of cancer support groups, again run both by our clinical trials nurses and some by our patient navigators, and then a lot of other activities. So in the closing 3 minutes, I will touch on the biospecimen archive. So this is really, the reason for putting up the timeline is to show that it takes time to set an archive up. I remember when the new chairman of pathology came in, Dr. Remick, in 2006, I believe, he was quickly encouraged to set up a biospecimen archive. The idea had actually taken root some years before, and pathologists are great ones for saving tissue, but of course you have to make sure that you do that in an appropriately, through appropriate mechanisms, through a well-established and clear informed consent process. So we took some years to set up this biospecimen archive. We adopted NCI best practices for biospecimen resources, and we're now consenting patients. We're able to consent in multiple languages. We have an employee who's been certified as a Spanish medical Spanish speaker, so she's able to quickly consent patients in Spanish if they want to be consented. And what's most important here is we just ran the numbers, and we've had over 1,200 donors, and 42% of those donors are self-reported as ethnic minorities. So these are the numbers just to show you. So with over 5,000 unique specimen units in the bank, we're able now to offer tissue from a diverse group of patients, which is very important for the research community. And I was just down in DC at one of the biospecimen archive meetings, and there continues to be a concern that we do not have good, high-quality specimens collected from patients who are non-Caucasian. And so this is a very important initiative at BU and BMC. I just got a couple of slides about quality assurance. You know, it's all about quality. We can fill the bank and the freezers and the liquid nitrogen vapor phase tanks with tissue, but we have to make sure that we have high quality standards, and the NCI is all about the quality of the samples that are collected, measuring cross-clamp time, how long the specimen is, how long it takes for the specimen to be transported to the pathology department, how long it takes before the specimen is frozen away. So all these pre-analytic variables are receiving a great deal of attention, and this just some pictures of our setup here in the new lab and our staff who diligently help prepare those specimens. So I think in closing, it's just a little summary of what we have available at the hospital and at Boston University, and really for you to take away the message that it's critically important to fight against health care disparities by making sure that we have adequate specimens in our biospecimen archive for research. It's critically important that we have resources at the hospital to provide for a patient population who have challenges getting to the hospital. And it's critically important that we can provide exceptional cancer care for all patients who come to our door. Thank you very much.